So the main reason for the study was we know that in general population about 30% of them are overweight or obese. And we did a study about a year ago trying to figure out if you're an obese patient, you go to the doctor, are you going to get diagnosed? And found that only about 30% of obese people who walk into the doctor get diagnosed, and about 20% of them get some sort of weight-related counseling. So we wanted to figure out why. And then about a year ago, I'm at the dentist, and he's got really bad teeth, and I'm thinking to myself, how can you care for my teeth if you can't care for your own teeth? And I started thinking, if you're an obese doctor, would that have an impact on the care that you give your patients? And so that also really grew, that sort of also contributed to this idea that we had for this study. So we found, in short, that if you look at physicians and you break them up by weight categories, you compare physicians who have normal BMI compared to those who are overweight and obese. Physicians who have normal BMI are more likely to provide recommended obesity care and report feeling more confident doing so. And so specifically, if you're a normal weight doc and we compare you to overweight and obese physicians, you're more likely to engage your patients in weight loss discussions. You're more likely to think that you should model healthy weight-related behaviors, and you're more likely to think that your advice to patients is trustworthy. So what do? We know that well-being is really important when it comes to physicians, and they have much higher rates of divorce, higher rates of stress, higher rates of substance abuse. And so if we can think about targeting programs which improve their well-being, that may also be an indirect way of addressing the obesity problem if we can get them to exercise more and eat healthier. But more directly speaking, what are some of the things we can do that make it easy for docs to provide obesity care? Typically, when you go to the doctor, the doctor has your chart and it has height and weight. It doesn't usually have body mass index, which is how we figure out if a person's obese or overweight. And so simply, if patient charts told physicians up front, this particular physician or this particular patient is overweight or obese, and here are some things you should discuss with them based on that information, I think that could go a long way in prompting physicians to do the recommended practice.